Good afternoon, this is Dr. Do again. This video is on alphabetic list of problem. Today I'm going to start with letter E, finish A, B, C, D. Just some major problems that I can think of, and then I just not following the anatomy or physiology, just following the list alphabetically. So today we're going to move on to letter E. The first thought why I think about E came to my mind was the eye. I have some videos about the eye, like the cornea, the glaucoma, the cataract, and the refractory disorders, even age-related retinal degeneration change. But I just put today this video since on the letter E, and so I just put the eye together. What kind of conditions that you need to visit the emergency, or what kind of condition you can manage at home, or what kind of physician you need to see. So basically for the eye problem, I can think emergency doctors, primary care doctors or eye doctors, and sometimes neurologists. But that is the after the confirmed diagnosis or suspicious of diagnosis, send you to the other specialist. So what kind of situation you need to visit emergency right away, especially for sudden vision change. You feel suddenly you feel one eye or two eyes feel like lost vision or completely obscure. That especially for those who have diabetes, hypertension, that probably means intravitreal hemorrhage because of the micro aneurysm I talked before, or the diabetic retinopathy. So if that's the case, you see emergency right away. And the secondly is if the eyes usually is one eye, particularly in Asian population, actually we tend to have the closed angle glaucoma. If the suddenly feel eye excruciating pain, very painful, you cannot tearing and photophobia, especially you may or may not know you have the history of glaucoma. So if that's the case, the sooner the better to save the sight, to save the vision. And of course the other one is trauma, injury, either chemical or from the household stuff, the detergent spilled in the eyes, even though small. Maybe, or the injury you work in the yard, the branch, or you have cat scratch your eyes, or your fingernail is long, you just or your skin are dry, just accidentally scratch your own cornea or structure, you feel like very painful. So if that's the case, you need to see the emergency to diagnose the severity of injury and then to treat. So these are the and the other ones you feel like suddenly like the curtain falling down through your eyes. It's called emesis fugax, which means either central retinal artery or blockage. So that's the case, very emergency, especially for those for those people old and older and have history of diabetes or hypertension, probably that indicating a sign of stroke, and presented as the central retinal artery blockage. So you feel like the curtain falling inside of your eyes, or the retinal detachment, which the same, you feel sparkling, swirling around, and the lost vision, and like a curtain falling off. So these are the emergency situation. You either go to emergency room, call your eye doctors, or call your family physicians or your primary care physicians. But the sooner the better. Go to the emergency room. Probably that's the best. Save time, save sight. Because especially if some of the conditions, really like glaucoma, the earlier the better. Or retinal detachment. If it's completely detached, that means cannot savable. So then they will let you go home. But if it's time, that's what I mean. Time is critical. So the sooner the better. Go to the emergency room. So these are the conditions really alert you to go to the to see a physician, eye doctor, or emergency room. Is there any condition you can manage at home? I am kind of hesitant or cautious with eyes, because we have seen the eyes are the soul of the window of our souls, which means it's so critical for the vision, for the sight. Is there any condition you can manage at home? I really recommend see your physician, see your eye doctor, even though the problem is very minor, but you do not know. For example, unless you're really busy, you know you have allergy, and you get some over-the-counter anti-allergic medication, but I still recommend you a couple of days when you have time, see your doctors, as either primary care or eye doctor, to make sure nothing serious going on. Even though it's allergy, and your doctor will advise you or give you some more effective medication, drops, or advise you how to prevent for the future. So I really think, even though you're dry, you feel like I just have the dry eyes, I know it's kind of feeling dry, I still recommend you see your doctor, see your eye doctor or primary physician, because there's a lacrimal nasal duct draining the tears to the nose. That's why when we crying, we feel nose also very wet and drainage, because sometimes this duct, just the tears just keep flowing. So on this duct dilated, so the tears cannot hold in the eyes, so you feel dry eyes. If you see eye doctor, they give you a plug to plug it off, so then your eyes will continue to hold the tears, so limit the dryness. So these are kind of very simple, straightforward, but if you just manage at home by yourself, probably you missed effective, more efficient way to manage it. My point is really, unless you're very, very busy, the problem is very, very minor, you can try over-counter jobs, but still I recommend you, when you're not busy, get it checked out to make sure nothing serious going on. So in between of this, actually basically everything you need to see your eye doctor or primary care physician. So what are the major eye problems based on the, we all have so refractory problem is very common, start from young, especially nowadays. It's more people had the nearsighted when at the young age. So if that's the case, probably parents or teacher are the first one to notice, because the children tend to squint very seriously. So if that's the case, or miss the questions in the exam, and the teacher might notice that the student had nearsighted. So if that's the case, go see your eye doctor to get glasses, get fit glasses. And for another category for young people's allergy, pink eyes, conjunctivitis, either viral, bacterial, or allergic. So any of these, very, very common. If it's allergic, then seasonal. If it's a bacterial, viral, pink eyes, you still need to see a physician and make sure not. Those are quite contagious. Make sure you isolate your personal, like a towel or a soap, everything, and separate from the family or the rest of your group. So that's very straightforward. And the other one is a corneal abrasion or ulcer. That's quite common, especially for those wearing contact lenses. Corneal problem is quite often, so you need to make sure to see your eye doctors. These are for the young people I can think of. And some of the older people with comorbidities with hypertension, diabetes, of course, when you were diagnosed with those kind of diseases, your physician already recommends you to see your eye doctor regularly. And besides of that, degenerative change, cataract is very common, and also AMD, age-related macular degeneration, is also quite common, particularly Caucasians. So if you are at advanced age and seeing distortion figures, then you get it checked out, make sure to start prevent early and to treat. And also glaucoma, there will be angle closed or angle opened. Angle opened glaucoma actually is more dangerous. It's not more dangerous, it's more common, but it's more subtle, and the progress is kind of a chronic, graduate, getting worse. So that's the case, especially for Asian actually, because our eye openings are smaller, so tend to increase pressure. So we have high risk of the glaucoma, especially closed angle. So get it checked out regularly to make sure the eye pressure is in normal range. If it's high, then your doctor will treat you. So these are the quite common eye conditions I can think of. Of course, on top of that, there's some not quite common, but it can happen. Depends on the comorbidities, your nutrition status, and your family history. So having said that, just the prevention for the eye problem, prevention, regularly blinking, do not stare at anything like screen or book too long, and make sure your hands are clean when you rub your eyes, and just don't sleep on contact lenses, and doing the regular massage on your eyes, and also make sure the vitamin E, vitamin C, and also vitamin A, those are, and the fish oil, omega-3. So these are the a group of the measures to prevent the degenerative change of eyes and also the other problems of the eyes. So these are the, I put eye problem together as a video. I very superficial touch some fundamental concept or problems, and mention what kind of emergency situation, what kind of situation you can manage at home. But take home message, I do not recommend you to manage anything at home, even though you just short time use some eye drops, but eventually when you're not busy, when your time is available, see your eye doctors or your primary care physicians. So this is the video. Still is quite longer than I expected, but I hope it helps to give you a clear idea what kind of condition of your eyes you need to see your doctor and or emergency, or your eye doctor or your primary care doctors. So this is the video for today, and thank you for watching. I will see you next time.